What are stroke protocols in acute care? When it comes to stroke care, time is of the essence. So, what exactly are stroke protocols in acute care? These are standardized, evidence-based procedures designed by teams of healthcare professionals to ensure quick and accurate assessment, diagnosis, and treatment for patients experiencing an acute stroke. The goal is to optimize patient outcomes by minimizing delays and guiding appropriate interventions from the moment a patient arrives at the hospital. One of the first steps in these protocols is rapid identification and assessment. Healthcare providers are trained to recognize stroke symptoms immediately. They often use standardized stroke scales, like the National Institutes of Health Stroke Scale, to evaluate the patient. This initial assessment includes gathering a detailed medical history, noting the time symptoms began, and conducting a physical examination focused on neurological deficits. Next, urgent brain imaging is crucial. A non-contrast computed tomography scan of the brain is performed as quickly as possible, ideally within minutes of the patient's arrival. This imaging helps differentiate between ischemic stroke, caused by a blockage, and hemorrhagic stroke, caused by bleeding. The results of this scan are vital for determining treatment options, such as whether a patient is eligible for thrombolytic therapy or mechanical thrombectomy. For those diagnosed with ischemic stroke, protocols outline specific criteria for administering intravenous thrombolytics, such as alteplase, within a narrow therapeutic window, typically within 4.5 hours of symptom onset. Mechanical thrombectomy may also be an option for select patients with large vessel occlusion, up to 24 hours after symptoms begin. These protocols also specify contraindications and monitoring requirements for these treatments to ensure patient safety. Monitoring vital signs is another critical component. Continuous observation of blood pressure, oxygen saturation, cardiac rhythm, and neurological status is essential during acute care, especially when administering thrombolytics. This vigilance helps detect any complications early. After receiving thrombolytics, patients are usually admitted to an intensive care or stroke unit for close monitoring. This includes frequent neurological checks and management of potential complications, such as bleeding. Coordination among healthcare teams is vital. Stroke protocols often include procedures for timely communication and transfer to specialized stroke centers if advanced interventions are necessary. This coordination can involve ground or air transport, ensuring that treatments continue during the transfer, and utilizing telemedicine when available. Documentation is also a key aspect of stroke protocols. Detailed records of times, clinical findings, and interventions are required. Regular reviews and updates of these protocols help ensure that they align with the latest evidence-based guidelines, ultimately improving the quality of care. In summary, stroke protocols in acute care are designed to streamline the hospital response to stroke, reduce treatment delays, and improve patient outcomes. These protocols are based on best practices established by major health authorities and stroke organizations. They are typically accessible in emergency departments and relevant hospital units, and they are reviewed and updated at least annually to reflect current standards. Always remember, if you or someone else is experiencing stroke symptoms, seeking immediate medical attention is crucial.